Blood pressure is the force exerted by your blood against your arteries. It can be measured manually or automatically. In the automatic measurement of the blood pressure of the patient, you will need an automated digital blood pressure monitor. Insert the air plug into the air jack. Then put arm through the cuff loops and position the arm correctly. The bottom edge of the cuff should be 1 or 2 centimeters above the elbow. The marker or the arrow under tube is centered on the middle of inner arm. Close the Velcro fastener when the cuff snugly encircles the upper arm. Press the start or stop button. Note down the reading of the systolic and diastolic pressure. Take the reading again 5 minutes later and note the readings and remove cuff. Take the average of 2 BP readings and that will be the BP of the individual. The normal blood pressure is less than 120/80 mm of mercury. In manual blood pressure measurement of the patient, you will need a sphygmomanometer and a stethoscope. Position the patient in a seated manner so that the arm and back are supported. Rest the patient's arm. Wrap a properly sized cuff around the upper arm. Lightly press the stethoscope's bell over the brachial artery. Then rapidly inflate the cuff to 180 mm of mercury. Then release air from the cuff at a moderate rate of 3 mm per second. Listen with the stethoscope and simultaneously observe the sphygmomanometer. The first knocking sound is the subject's systolic pressure. When the knocking sound disappears, that is the diastolic pressure.
The pulse rate is a measurement of the number of times the heart beats per minute. The pulse can be found on the side of the neck, on the inside of the elbow, or at the wrist. With the pads of your index and middle fingers, compress the radial artery until a maximal pulsation is detected. Count the rate for 60 seconds. The normal pulse rate for healthy adults ranges from 60 to 100 beats per minute.
The respiration rate is the number of breaths a person takes per minute. With the patient at rest, count the number of times the chest rises in 1 minute by visual inspection. The normal respiration rate for an adult at rest is 12 to 20 breaths per minute.
Cervical lymph nodes are the small structures of lymph nodes located in the neck region. Nodes may become enlarged, fixed, firm, or tender depending on the pathology present. This may indicate lymphadenopathy or an infection or cancer. When palpating this region, it is best to use the pads of the index and middle fingers to note the size, shape, number, pliability, texture, mobility, and tenderness of nodes bilaterally.
Position the patient's neck, flex slightly forward. Palpate the head and neck nodes with both hands, one on each side. Palpate the preauricular, posterior auricular, and mastoid nodes in front of the ear, behind the ear, and superficial to the mastoid process, respectively. Palpate the tonsillar nodes located at the angle of the mandible, the submandibular nodes midway between the angle and the tip, and the submental nodes a few centimeters from the tip. Palpate the anterior and superficial cervical nodes in front of and overlying the sternocleidomastoid muscle, respectively. Palpate the posterior cervical nodes between the anterior edge of the trapezius muscle and posterior edge of the sternocleidomastoid. Palpate the supraclavicular nodes deep within the angle formed by the sternocleidomastoid muscle and clavicle.
The thyroid gland is located in the lower part of the neck, below the Adam's apple, wrapped around the trachea. With the patient sitting comfortably, inspect the thyroid gland. Ask the patient to flex the neck slightly forward. Then place the fingers of both hands on the patient's neck so that your index fingers are just below the cricoid cartilage. Ask the patient to sip and swallow water. Feel for the thyroid isthmus rising up under your finger pads. Displace the trachea to the right with the fingers of the left hand with the right hand fingers. Palpate laterally for the right lobe of the thyroid in the space between the displaced trachea and the relaxed sternocleidomastoid.
The parotid gland, the largest of the salivary glands, lies in front of the ear and wraps around the posterior border of the mandible. The parotid gland is palpated with a bilateral technique wherein the fingers of both hands are used. Have the patient clench his or her teeth so that the anterior border of the gland may be defined better. The submandibular gland resides just under the inferior border of the mandibular body and is best palpated by manually. With your one hand in the lateral floor of the mouth, palpate the submandibular gland with the other hand. The gland is usually soft and mobile and should not be tender to palpation. Inspect first the symmetry of the face, especially on the area of the temporomandibular joint or the TMJ. Upon inspection, attention must be paid to any local swelling, deformation, deviation of the chin, and teeth wear. Maximum opening of the mouth is described as the greatest distance between the incisal edge of the maxillary central incisor to the incisal edge of mandibular central incisor, when the mouth is opened as wide as possible. Instruct your patient to open the mouth as wide as she can but without pain. Then, using a ruler with a millimeter scale, measure the distance between the edges of the upper and lower central incisors. For the evaluation of the range of motion or the mandibular jaw movement, ask the patient to open and close the mouth slowly. Then observe the opening pattern for deviations. The mandible often deviates toward the affected side during opening. For the external palpation of the condyles, place the tip of the finger placed just anterior to the tragus behind the condyle, exerting some anterior directed pressure against the posterior aspect of the joint. Have the patient close slowly and you will feel the condyle move posteriorly against your finger.
For the external auditory canal palpation of the condyles, place the tip of your finger in the external auditory meatus, exerting some anterior directed pressure against the posterior aspect of the joint. Have the patient close slowly and you will feel the condyle move posteriorly against your finger.
During mandibular motion of the patient, the TMJ is auscultated. The clinician must listen for crepitus or grinding and clicking or popping sounds. Then do the same procedure on the other side. For the palpation of the masseter muscle, ask the patient to open their mouth or clench their teeth. Palpate the masseter at its attachment to the zygomatic arch and angle of the mandible. For the temporalis muscle, ask the patient to clench their teeth. Palpate the temporalis both in the temporal fossa and intraorally along the ascending ramus of the mandible. For the mastoid head of the sternocleidomastoid, ask the patient to tilt their head laterally and follow the position of the sternocleidomastoid upward. Pinch towards the mastoid area.